New billboards have popped up across the Queen City and several suburbs. They all contain the same message.
The campaign is called Who is My Neighbor? And it's meant to spark conversations about how we treat each other in the city of good neighbors. To tell us more about it, right now we are joined by Dr. Myron Glick with Jericho Road. Dr. Glick, thank you so much for coming in this afternoon.
Thanks for having me.
So we will show some images of the billboards in just a moment, but tell us more about this campaign and the impetus behind it.
I've been a doctor here in Buffalo for almost 30 years, and in this moment in time, it just feels like there's a lot of rhetoric in our country that's speaking against some of the people, my neighbors, who I've served all these years, whether it's the newcomer, someone who's here as an immigrant or a refugee or an asylum seeker, someone who's transgender, someone who doesn't have insurance or is homeless. And so we were thinking, what can we do just to sort of take a stand? And so that's what this is about. It's not branding, it's not marketing. We don't need any more patients. It's really to challenge the Western New York community to think about who is my neighbor and how do we love them.
Dr. Glick, you are in a very unique position with Jericho Road. For folks who may not be familiar with Jericho Road and your expertise, could you talk a little bit about that incredible organization?
Yeah, I mean, we're a federally qualified community health center. We have 5 different health centers across Buffalo, and we do a lot of programming and other kinds of support in the community. We also run a shelter called Vive, which helps asylum seekers who are trying to find a home somewhere that's safe for their family, temporarily have shelter so they're not on the street. And so we're a large organization. We take care of some of the most vulnerable neighbors that we have here in Buffalo.
So when looking at this campaign, as we said before, it's meant to spark conversation. And sometimes that conversation can be hard, and that's okay. What do you hope people talk about? What do you hope they take away from seeing these messages around Buffalo?
Yeah, I think, you know, our faith is important. This comes out of the story of the Good Samaritan on the Jericho Road. And really it's about trying to get folks, we're all neighbors and we shovel each other's drives out. We provide food. I mean, we know what a neighbor is, but that story challenges our notion of who is our neighbor. It's not just a person that looks like us, that lives next door, that speaks our language. It may be the person along the way who's in need. And so broaden the idea of who is our neighbor, and then say, what does it mean for us to stand in the gap as people of goodwill, as people of faith, just as Buffalonians, to truly live out what it means to be a city of good neighbors.
I want to preface this question by saying you don't need to hear from your patients. You can act on your own. This campaign, whatever's behind it, you can make these decisions on your own. I'm curious, though, if there's any feedback that you're getting from clients or from patients that added to you feeling a sense of responsibility for wanting to take this stand. Do you hear from your patients and clients that maybe they do feel marginalized?
Yeah, I mean, sure. Yeah. I think, you know, we have practices on the east side of Buffalo, and folks that have generationally experienced racism and, you know, the challenges of being in a situation that is not always fair or equal. We deal with right now immigrants who are afraid.
Sure.
They don't know what the next couple weeks will hold. And so, yeah, we definitely almost on a daily basis, I would say our providers are dealing with folks who are afraid, who have been marginalized, and who have been shut out from experiencing the same success that you and I have as privileged people in this country.
I think it's also interesting to note that while you do provide this medical care for these folks, what you're just describing goes far beyond a physical checkup, right? I mean, you're really talking about supporting these folks beyond just the physical.
Right. I mean, I think I've realized that way back is that so much of the illnesses that we see that come into us are related not just because of the bacteria that causes pneumonia, but they're illnesses that are in a social situation. And that social situation, if you don't have enough food, if you're being beat up at home, if you're experiencing racism, if you don't have health insurance, if you're fleeing for your life and you have no documented papers, that adds to why you are sick. And so for us, if we want to see this community be whole and healthy, we have to address some of this other stuff. So yeah, I mean, I'd rather just be a doctor in my exam room. I'd rather not be talking to you guys today or having this up on these billboards up, but it's important.
Yeah.
Before we let you go, we are out of time. I do want to ask you one more question. You know, for anyone out there seeing this message and they're thinking about the city of good neighbors, giving back to their neighbors, wanting to do more, maybe they want to do more with Jericho Road, how can they do so?
Well, our website, jrchc.org, but most important, listen, there are many really good people in Western New York who do it every day. Keep doing that. And then just wherever you are, this moment demands all of us being our very best.
Dr. Myron Glick, thank you so much for joining us here this afternoon. Really appreciate your words and your feelings
Thank you.
and your perspective. Thank you.
Thank you, guys.